Good morning, everyone, and thank you for joining us for today's webinar. I'm Amanda Hooper from the National Women's Law Center, and I have just a few housekeeping notes before we get started. First, all lines will be on mute during the webinar presentation today, but we will open the floor for questions and answers at the end. There are two ways that you'll be able to submit questions. First, you can submit a question by typing it into your webinar toolbar at any time, and we'll make sure to get to them at the end. And then also, we'll be able to open up the phone lines at the end, and I can explain more about that a little bit later. Please also note that you will receive a link to the recording of today's webinar, as well as the slides. And without any further ado, I will turn the floor over to Gretchen Borschelt, who is Vice President for Reproductive Rights and Health here at the National Women's Law Center. Gretchen, take it away.
Thanks so much, Amanda, and good morning, everybody. And thanks to Upstream for inviting me to join you all and to talk to you about the Affordable Care Act birth control benefit. And hopefully I'm going to tell you everything you need to know about the law and its requirements, and so that when you're dealing with patients who have insurance that should be covering birth control, they are going to get that coverage and not have to pay anything out of pocket. That's the goal for today's webinar, and really excited to be here with all of you, and so interested and inspired by the work Upstream is doing in Delaware, and are really happy to be a part of it. So we will go ahead and get started. I put a picture of myself so you can see who's talking at you for the next little bit. I'm Gretchen Borschelt. I'm Vice President for Reproductive Rights and Health at the National Women's Law Center. For those of you who aren't familiar with the Law Center, we are not too far away. We're in Washington, D.C., and we have been working for more than 40 years to protect and promote equality and opportunity for women and families. And so what we do is we champion policies and laws that help women and girls achieve their potential at every stage of their lives. So that's at school, at work, at home, and retirement. And you know, what we try and do is make sure not only that people are informed if good laws exist, but that they're working for them. And that's where we are with the birth control benefit. So we have been very involved in every aspect of this part of the Affordable Care Act. We helped to get it passed in the first place, and now we're really working to make sure that people know about the benefit, patients, providers like all of you, and make sure that it's working the way it should. That's our goal in terms of helping women across the country achieve their full potential here. So I'm really excited to join all of you today, and what I wanted to do was to just kind of review what I'm going to be covering in the webinar. And so what I'm going to be doing, as I said, is talking specifically about the Affordable Care Act's requirement that plans provide coverage of birth control without out-of-pocket costs. But in order to do that, I'm going to put this benefit in the bigger picture of the Affordable Care Act, because it's helpful to understand where this benefit is coming from and how it fits in with all of the other things that the Affordable Care Act does. So I'm going to spend a few minutes doing that. But then I'm going to go into detail on the requirements and the nitty-gritty of the birth control benefit. I'm going to talk to you about who has to cover, what they have to cover, and all of the details, everything you wanted to know, hopefully. And then I'm going to tell you about our hotline, Cover Her, which is a resource for you and for your patients, and how we can be helpful to you as you wrestle with some questions that might come up. And I'm going to walk you through some of the common problems that we encounter through Cover Her, and for what we know from looking at insurance plan documents and otherwise having an ear to the ground on how this benefit is working, and walk you through some case studies for how to solve some common problems. So that's the goal for today. There will be plenty of time for Q&A, and I hope that you all will raise questions or concerns you might have. I'm going to incorporate some of the questions we've heard from other webinars we've already done, so hopefully we'll cover as much as we can, but if you have anything else, we're happy to hear that. Okay, so going ahead and getting started. So putting the birth control benefit in the bigger picture is important, and it's worth a reminder of what insurance was like before the Affordable Care Act. And I have this picture here of a woman with a denied stamp on it, because we know that prior to the health care law, prior to the Affordable Care Act, the insurance market often failed women. So plans could outright deny women coverage just for being a woman. That's because they could deny coverage for pre-existing conditions, and for women that often meant being pregnant or having had a prior cesarean delivery. It meant that women who were getting treatment for being survivors of domestic violence or rape could be denied coverage. And so women often couldn't even purchase health insurance coverage in the first place in the individual market. And then if they did get coverage, if for some reason they weren't denied, what they found is that they were charged more than men. Women were routinely charged more than men for the same coverage. It was a practice called gender rating that plans practiced in the individual market, and it was unfair, and the Affordable Care Act changed that. And the other problem was that when women were able to get coverage, they often found that they didn't get what they needed, like maternity care or other important services, prescription drugs or mental health services, whatever it was that a woman needed, she often couldn't get it. And certainly when it came to birth control, there was an unmet need. We know that prior to the Affordable Care Act, the cost of birth control made up 30 to 44% of women's total out-of-pocket health care costs. So that's a lot that a woman was spending on birth control. And for some women, you see a chart here that we did about minimum wage workers, you can see what it takes for them to be able to pay for the out-of-pocket costs for different methods of birth control. And you see here the upfront cost of an IUD, for example, that could be around $1,000 if there's no coverage. That could be nearly a month's salary for someone who's working full-time at minimum wage. And so for many women, that meant they couldn't afford the more effective long-acting methods, or they would have trouble even paying for the pill, right? And so what we know is that the cost associated with birth control and insurance coverage not fully covering it meant that women were using birth control incorrectly or inconsistently, and some were just foregoing it altogether. That meant we had higher unintended pregnancy rates, and that meant greater health risks to women and any children that they were going to have. And you all in Delaware unfortunately know this better than anyone else, given the unfortunate distinction you have of having the highest unintended pregnancy rate in your state. So, you know, all of this meant women and children were not as healthy as they could be, that they were paying out of pocket for things that were forcing them to make tough choices that they didn't want to make. And it also meant that some women who couldn't prevent and plan and space pregnancies weren't able to kind of participate in the social and economic life of the nation the way they wanted to. It was hurting their ability to move forward in their education and their career. And so all of these reasons, the way it was for women before the Affordable Care Act, all of these things have now been solved. And that's why we love the Affordable Care Act. So it solved the problems that women face in terms of coverage generally and coverage of women's services specifically. So as I already mentioned, some of the things that they fixed, plans now can't charge women more than men, so no more gender rating. Plans can't deny coverage because of pre-existing conditions, so being a woman is no longer a pre-existing condition. We know that plans have to cover the services women need, like maternity care or prescription drugs. We know also that plans have to cover a set of preventive services without additional cost sharing. And that's where we're going to focus in a little bit more now here, because that's where the birth control benefit comes from. So let's talk about the preventive services requirement. So what it says is that new plans have to cover this 4 buckets of preventive services without any additional cost sharing. And you can see here I've listed out the 4 categories, the 4 buckets of preventive services that plans have to cover. So the first bucket is items or services that have an A or B rating from the USPSTF, which is the U.S. Preventive Services Task Force. And that list changes, and we know that they update it. And so the law doesn't specify what those services are. It just links to kind of this bucket of services that the USPSTF determines. The second bucket are immunizations that are recommended by the CDC. The third bucket are preventive care and screenings for infants, kids, and adolescents as determined by the Health Resources and Services Administration, which is an agency within the Department of Health and Human Services, HRSA. And then the final bucket is the one where the birth control benefit comes from. That's preventive services for women as determined by HRSA. And before we dig into that 4th bucket quickly, I just want to pause here and highlight one of the services that comes up in that first USPSTF A or B rating bucket, because this is one that I know your clinics often deal with, and that's STI screening. So this can come up, obviously, for birth control, right? You need to do STI screening in order to get women certain forms of birth control. And so I just want to make sure that you all know that this is actually required to be covered separate from birth control. And so you see here that the recommendation, the A rating, is that that women are screened, sexually active, non-pregnant women are screened if they're at increased risk of chlamydia, gonorrhea, HIV, and syphilis infection. And so that is covered as a preventive service separate and distinct from birth control. But now let's talk a little bit more about the women's preventive services bucket. So this list has been created by two independent expert panels who considered evidence and data and looked at where the gaps were for preventive services, which services for women were not being covered and were critical to women's health and the health of children and families. And so this is the list they came up with. And so as you see, contraceptive care is listed there. That includes counseling, initiation of contraceptive use, and follow-up. And that's listed alongside all of these other women's preventive services. So things like breastfeeding services and supplies, cervical cancer screening, HIV infection screening, interpersonal and domestic violence screening. And you see more here, STI counseling is here, the Well Woman preventive visits. So all of these things have to be covered now by new plans without any additional cost to women. And you might notice that I keep saying new plans. So let's talk about who has to comply with this requirement and what we mean by new plans. Well, new plans really means that there are some that aren't considered new. That's a distinction that means something. And what I mean is that if there are plans that existed prior to the date the Affordable Care Act was signed, so that's March 2010, and they continue to exist just as they were, they haven't made any significant changes, then they are considered grandfathered. They're grandfathered in, and they don't actually have to comply with the birth control benefit. And that's important to know because you might still be seeing patients who are in grandfathered plans. And if they're in grandfathered plans, this benefit is not required. Now we know the percent of grandfathered plans is decreasing rapidly. So in 2011, 72% were grandfathered. In 2015, only 35% were. And we know that number is going to continue to decrease because plans are making the changes that makes them lose their grandfathered status. So eventually we'll be at zero, but for now there still are some plans that are grandfathered, and you all need to know that you may be dealing with an individual who's in a grandfathered plan, and so this benefit is not required. But for the vast majority of plans, they do have to cover it. And also plans that are purchased in the individual market. So these are plans that people purchase on their own, either in the new marketplace or outside of the marketplace. And those sometimes are through an insurance agent or broker, or sometimes people are buying directly from the insurer. But if they're purchasing in any of those ways, those plans have to comply with the Affordable Care Act's birth control benefit. And then finally, individuals who are in the Medicaid expansion population. Delaware has chosen to expand its Medicaid population, which is great, reaching women that otherwise would fall in a coverage gap. And those women have this benefit in the same way as if they were in private insurance. So that's a really important population to keep in mind. Okay, so that's who has to comply. Now, what do we mean by no cost sharing? No cost sharing means no deductibles, no coinsurance, no co-payments. So a woman is paying her premium, she does have that payment, but beyond that, she shouldn't have any kind of concern about cost for birth control. That should be covered fully at 100%, and she shouldn't have to pay anything out of pocket. That's what we mean by no cost sharing. Who is covered? Let's talk about that for a minute. So this coverage is for all enrollees. That includes dependent children. If the plan is offering coverage to dependents, then they have to get these preventive services without cost sharing. And of course, that's a big deal because we know another great part of the Affordable Care Act is that individuals can now stay on their parent's plan until they're age 26, right? So there's more dependent children being covered, and hopefully they now are being able to access those preventive services without cost sharing. So that's the overview of the women's preventive services generally, and how compliance works. Now let's talk nitty-gritty about the birth control benefit. And I want to start by highlighting a couple of questions that we sometimes hear from healthcare providers, and just kind of read these out loud to you so you can see the kinds of questions people usually have. So the first one here is saying, I'm a scheduler in an OBGYN office, and I have a patient, and when I called on her benefits, they said her plan is not covered under the women's health care mandate. I was under the assumption that this is not correct. How can I find out for sure? The second question says, under the ACA, which is the Affordable Care Act, shouldn't birth control pills be available without copay, or do they have to meet their deductible first? And then the final one is saying, we've had some insurance claim denials on IUDs and Nexplanons. The particular policies involved are policies purchased through the exchange program. So by that, they mean through the marketplace of the Affordable Care Act. The insurance reps are saying that the devices fall under their deductible. Any recommendations? So these are the kinds of things we hear and we know, and I'm going to walk us through know how this is true, that all of these things should not be happening, that women should be getting coverage for the birth control pill without copay. They don't have to meet a deductible. They should be getting the coverage for IUDs and Nexplanons, that they shouldn't have to pay for deductible first. So all of these things should not be happening, and I'm going to explain why that's the case in these next slides. So the requirement is that plans have to cover all FDA-approved methods. And so the first question is, what are those methods? And I have a link here, which is the birth control guide put out by the FDA that defines those methods. And I actually have those methods here on the next slide so you can see, but I wanted to include the link too so you know where to find that list. So here is the list of all FDA-approved methods that appear on the guide and have to be covered without cost sharing. And so you see here there are 18 method categories for women. So sterilization surgery for women, sterilization surgical implant for women, the rod, IUD with copper, IUD with progestin, shot injection, patch, the ring. There are 3 categories you see here of oral contraceptives: combined pill, progestin only, and extended continuous use. Then we have the diaphragm with spermicide, sponge with spermicide, cervical cap with spermicide, female condom, spermicide alone, and then the last 2 are 2 categories of emergency contraception. Ella has its own category, and then Plan B and others like that are a separate category. So these are the 18 categories, methods of FDA-approved birth control for women that plans have to cover. Now there's an important thing here to know. All FDA methods does not mean every method that exists. It is true that the plans have some leeway. Now they don't have total leeway. They cannot exclude a method entirely, and they can't only cover generic birth control, but they can do a few things. So one thing is that they can exercise what's called medical management within a method category. So in other words, within a method category, they can choose to only cover one item. So let's just talk about how that would play out, right? So let's look at IUDs, hormonal IUDs, right? So we know from our list, hormonal IUDs are a separate method category. Now within that method category, they could decide, okay, we're only going to cover Liletta. Liletta is the only one that we're covering without cost sharing. So that could mean that if a woman wants Skyla or Mirena, or the new one whose name I can't remember, that she might have cost sharing, or the plan might say you can't get that coverage. But the plan cannot, for example, choose not to cover Paragard, the IUD copper, because that's its own method category. So it has to cover that. But they do have some leeway within method categories. And plans can also choose to cover generics instead of brand names. That's obviously most relevant for the pill. But obviously, if there is no generic, again, like an IUD with copper, if it's the only thing in the method category, Ella, right, then they have to cover that. So those are important things to remember. Now, that leeway that I just described might seem problematic for your patient, right? Because what if your patient needs Skyla? That's the right thing for her, but the plan is saying we only cover Liletta without out-of-pocket costs. Well, the good news is that there is a workaround, one that actually guarantees your patient gets the exact item she needs. And so in reality, all kind of does mean every, and that's the waiver process. So this is required to be in place from plans. So what plans have to do is have a process that allows the woman to access the very specific birth control product her provider says is best for her without any cost sharing. Even if the plan typically doesn't cover it, even if the plan typically imposes cost sharing, if a woman and her provider decide that one particular item is the best one for her, she has to be able to get it. And what this involves is the provider completing some paperwork on why that method is medically appropriate for her. And what's amazing here is that the plan is required to defer to the provider's determination of whether it's medically necessary. That doesn't usually happen, as we know, in insurance plans, right? They have their own definition of medically necessary, and it's often very limiting, and it means often that people don't get the coverage they need. Here, That's not what we're talking about. What we're talking about is a definition of medically necessary that includes things like the severity of side effects and the differences in permanence and reversibility of birth control, the ability to adhere to the appropriate use of that item or service as determined by the attending provider. So it's very deferential to the provider, and it should mean that a woman gets the particular item she needs. It is not the prior authorization process. That's not an appropriate way to make this determination because the definition of medically necessary is different in that process. So really what we're talking about is a different kind of process. And just as an example, so say you have a patient who has had bad side effects when she uses a generic version of a drug, but tolerates the brand name drug. We know that happens. And so you determine that the brand name drug is medically necessary for her. Then even if the plan doesn't cover that brand name drug, or even if they would put cost sharing on that brand name drug, they have to have a waiver process for your patient that you can help her with so that she can get coverage of that brand name drug without cost sharing. So as I said, this process, this waiver process, really is a way that all means every, despite what I said earlier. Okay, so let's talk about some other things related to the birth control benefit. One thing that is required is that plans have to cover services that are associated. So services related to follow-up and management, side effects, counseling for continued adherence, device removal. So this is important because we know it's not just the birth control method itself. That's not the only thing that's part of the preventive service. And that's because we know there are costs associated with the birth control method that could mean that a woman can't access that method if she has to pay for those associated services, right? And that's exactly the opposite of what this law is supposed to do, which is to remove the barriers of cost sharing. And so not only is the method required to be covered, but the associated services that could keep a woman from accessing that. So just as some examples, right? A plan has to cover IUD insertion, also the clinically indicated ultrasound to confirm placement, removal if and when the woman's ready to have it removed, and for sterilization that means anesthesia and confirmation tests. So all of these things have to be covered without any additional cost sharing. It's not just the birth control item or product itself. I want to talk about a few other things that plans can do. One thing is that a plan can impose cost sharing if a patient goes out of network. And so that's important for you all as clinics. If your clinic is dispensing birth control pills but the plan's in network pharmacies or CVS or Walgreens, then it could be that your patient has cost sharing at the clinic. So it's important for all of you to make sure that your clinics are in network for these plans and not considered out of network providers that could require the woman to pay cost sharing. Another thing that plans can do is require an individual patient to get a prescription if she wants an over-the-counter method covered without cost sharing. So, for example, emergency contraception, right? Plan B covered without cost sharing, then you might have to get a prescription since it is an over-the-counter product. So that's something to keep in mind. So that's an overview of the details of the birth control benefit and the different ways it's starting to play out. And what I want to do now is talk a little bit more about our resources that we have and then walk you through some case studies of the problems that we hear and how to solve them. So our hotline, here you see our little logo, coverher.org, and we are here to offer one-on-one assistance to women. They can call us. You'll be seeing the phone number. I'll put it up a bunch of times as we go on, or they can visit our website. And on our website, we have a bunch of resources for people. We have Q&As, we have sample appeal letters, we have a script for calling your insurance plan. And what a woman gets when she visits our website or calls us is basically all of the things that we've been talking about. So basics about the law's requirement, what plans are and are not allowed to do when it comes to cost sharing, how to figure out if this part of the law applies to their plan, and then the kind of materials, the instructions, the sample appeal letters that they need if they need to appeal cost sharing that has been put on them in error. And so what we have been finding lately, I said we do have a telephone hotline that women can call, but what we're finding is that more and more individuals are just using the resources we have on our website and handling it themselves. And they only call us if there's a question that's really vexing them, if they're having trouble and they can't solve it themselves. So we are very confident that our materials are easy to use and we know women are using them, but we're also happy to talk to anybody on the phone if they have questions or need more help than they can get on the website. And to answer a question that we got in a prior webinar, these resources and services are only available in English right now. So for patients that have other languages, unfortunately, we can't help them through our hotline, but we can try and help you all find other sources of help for non-English speaking patients. I also want to point out that our hotline is here for individuals who are having trouble with any of the women's preventive services. So even though we're just talking about birth control today, and most of the contacts and the work we do is on birth control, but really we have sample appeal letters for women who have been inappropriately charged cost sharing for other women's preventive services, breast pumps and well woman visits and other things too. So that's all part of the law's preventive service requirement and should all be covered without cost sharing. And so we're here for women no matter the problems they're facing with the women's preventive services. So we know with any new law or requirement, it does take some time for full compliance. And so we have heard some problems for women on the Cover Her hotline. Some of those problems have shifted as the plans have come more into compliance and changed, and some things have been solved, but we are still hearing some common problems. And so I just want to flag some of what we hear on our hotline in case these come up for you all as well when you're dealing with individuals. So the first problem is we're just still hearing from women who are not getting coverage without cost sharing. Now it might be because they're in a grandfathered plan. Like I said, that's still a possibility. There are still grandfathered plans out there, and we know that the best way to know if a plan is grandfathered or not is to just call the customer service number on the insurance card. And we, on our hotline, on our online resources, we have a flow chart of questions for individuals to ask the insurance company that will help them figure out if they're grandfathered, kind of help them navigate the system to figure out the answer to this question. And sometimes it takes multiple calls to figure it out. As we all know, it's not always simple to get a straight answer the first time you try and call an insurance company. But that might be why women aren't getting the coverage without cost sharing. And then if we hear if that's the problem, what we'll do is help refer a woman to a clinic. And it sounds like you all will be there for women even if they don't have the coverage. But we then refer a woman out to a clinic that can help her even if she doesn't have the coverage. The other group of women who might not be getting coverage without cost sharing are women who work for churches or other houses of worship. So those religious employers were given an out from the birth control benefit, and the women who work for them don't get that coverage. And so that's another population that might not be getting coverage without cost sharing. But otherwise, if they're not in a grandfathered plan, if they don't work for a religious employer, they should be getting this coverage. And so it might be that the plan's just violating the law. And so we will help a woman figure out why the plan is doing that and take the steps necessary to remedy that problem. We are still hearing from women who are in plans that aren't covering the associated services, right? So women are still paying for follow-up visits or necessary tests, and we hear this a lot when it comes to IUDs and implants, where the follow-up visits and tests are a particular problem for women. So there was one woman who contacted Cover Her who was charged for both a pregnancy test and an ultrasound related to her IUD. Another woman who contacted us got a $700 bill for the ultrasounds when her IUD had to be replaced. And so these are things that should not be happening. And we have helped those women to appeal those charges and get those reversed. So that's a problem that we still know is ongoing, and it may be something that you all have to wrestle with. Another problem that we're hearing is plans that don't have that waiver process in place, right? So we talked about how the waiver process is so important to make sure that a woman gets the particular item or method she needs, but we know that some plans haven't fully put that process into place. We also know that some plans are putting women into the prior authorization process, and that, as I said, is not the appropriate process here. They need to have this separate process that completely defers to the provider's determination of medical necessity. The other problem that we know is that even if a plan does have a waiver process, a woman often has really a hard time finding out about it. So she doesn't see information about it in her plan documents. She's looking on the website. She's tried to contact customer service representatives. There's just a lack of awareness about this process and that it needs to be in place and what it needs to do. And so we've been working with plans directly to try and make sure that they have that process in place and to make sure it's clear and transparent and that women can find it. So that's something that you all might have trouble with too. This fourth bullet here, accommodation, what that refers to are women who work for an employer or go to school at a religiously affiliated institute or a religiously affiliated employer. So it's not the church or house of worship, but it's something like a Catholic hospital or a Catholic school. And so what in this case has happened is that the Obama administration gave these employers an out where they don't have to provide it in their employer health plan, but it still guarantees the women have the coverage. So the women are actually getting the coverage directly from the insurance company. It's kind of carved out of their employer or student health plan, but they are provided it directly from the insurance company. So it's the same insurance company. In theory, a woman shouldn't even know that this has been carved out. She should still be using the same insurance card, although sometimes we've heard that women might have a separate card for this. But all the mechanisms, all the kind of billing and details on that takes place behind the scenes. The insurance company handles it on their end. For the woman, it should be seamless. She should get that coverage just like any other woman in any other plan. But you could hear of someone who's in this kind of accommodated plan, and there could be some hiccups. Sometimes we know that it's taken a few steps to make sure that the woman is getting that coverage the way she should. And then the last thing I want to flag is some problems we've heard for older women. So, they continue to need birth control. It's not like when you turn 50, all of a sudden everything shuts down, right? So we know that some plans, unfortunately, treat women that way and have put in policies that say, okay, we'll cover this without cost sharing until you're 50, and then after that, forget it. And that's just not appropriate. It's not legal. So this coverage is required for all enrollees who have reproductive capacity, no matter your age. And so that's something to keep in mind, too. Okay, so those are the common problems. Now I just want to walk you through a few case studies and how we would go about solving them. So the first one here you will see is in private insurance. We often hear, it's decreased a little bit. We've changed a lot of plans, but we used to hear a lot that plans said, well, we don't cover the ring because we cover other hormonal methods like the pill. Well, we all know those are not equivalent, right? The ring is very different from taking a pill. And we also know that this is just a violation of the law. They have to cover the ring. It is a separate method category, going back to that slide of all method categories. And so they can't do this. And so if you have a woman who's in that situation, the steps to take are, one, to find out if the Affordable Care Act applies, right? So make sure she's not in a grandfathered plan, make sure she doesn't work for her church or their house of worship, and if she doesn't, then that should be covered without cost sharing. And so the steps would be to file an appeal. If that's not successful, you want to file a second-level appeal or a second-level review of that. And then if that's not successful, file a complaint with the government agency that regulates the plan. And for individual market plans, that's the State Insurance Commissioner, and for employer plans, that's Department of Labor. And we have sometimes had to go through all of these steps for plans and for individual women to make sure that they get the coverage they need. So sometimes we can solve it on step number 2. Sometimes we have to go through all the way to step number 4. But it's important for you all to remember that we are here. The Cover Her Hotline is here to help a woman and to help you figure this out. Like I said, we have a flow chart for individuals to call their plan. We have instructions for filing an appeal. We have sample appeal letters. So hopefully that will take a lot of the work off your plate and off the individual patient's plate in terms of taking these steps that need to be taken in order to ensure that that birth control method is covered without cost sharing. So that's example 1. Now let's look at a Medicaid example. And I know I'm talking mostly about private insurance, but as I said, Medicaid, the expansion population in particular, needs to be providing this coverage. So here in this example, you and your patient decide that a hormonal IUD is the best method for her. But when you check the coverage under Medicaid, you're told that all hormonal IUDs require prior authorization, but the copper IUD does not. And that is a violation of the law. They can't do that. And that's for the Medicaid expansion population. That's because you have to follow the same rules as private insurance when it comes to birth control. And we know that hormonal IUD is a separate method category, and at least one item in that method category has to be covered without cost sharing. No prior authorization, nothing else. And so that's a violation that needs to be addressed. Now, in the traditional Medicaid program, not the expansion population, they don't have to cover the birth control benefit the same way, but there are really important protections there, and there are rules about not being able to limit an enrollee's free choice of family planning method, and so that should be challenged too. Shouldn't accept that that's okay. And so the next step there would be to file an appeal with the Medicaid agency or the managed care organization or both to make sure that this is corrected. And so the Cover Her hotline, we're here. We can definitely help patients who are in the Medicaid expansion since the rules are the same, and we're here to help you with that. For traditional Medicaid, we might have to refer out, but we're happy to, help that person find someone who can help with that, or help you all find someone who can help with the traditional Medicaid problems. So again, Cover Her hotline is here for you. And then the final example that I have is a problem with associated services. So in this example, let's say you and your patient decide that copper IUD is the best method for her. And you check the coverage in your patient's plan. You're told the IUD is covered at 100%. The patient makes the insertion appointment. You order the IUD. You have the IUD inserted, and everything's covered, 100%. But then the patient returns because there's a bleeding pattern with her IUD, and she gets an explanation of benefits that says, oh, you owe money for that follow-up visit. The patient calls her plan, and the plan tells her, oh, well, we cover the IUD at 100%, but we don't cover the follow-up visit because follow-up visit is not a preventive service. Or, we also hear, well, we cover the device, the insertion, and removal, but that's it. We don't cover anything else related. And as we talked about before, that is a violation of the law. Plans have to cover associated services. They have to cover follow-up visits. And so the next steps here are the same as we've already talked about. The steps are figuring out if the law applies for the plan, making sure that she's not in a grandfathered plan or doesn't work for a church or other house of worship, and then to go through the appeals process, all the steps that we need to go through to make sure that that gets corrected and that the woman gets the coverage that she needs for her follow-up visit. Again, we are here at Cover Her to help you or your patient to go through that process and make sure she gets what she needs. And I just want to say, it sounds like a lot, right, taking all of these steps, but it's so important. It's important not only for the individual woman to get the coverage that she needs and to get rid of any cost sharing that may have been put on her EOB or tried to take from her, or money that she's paid to get that reimbursed, but also it helps in terms of other women who are in that plan, because we know that plans, once they realize there's a problem, hopefully, should be changing it for everybody. And that's the experience that we've had, is that working with one individual woman actually is able to change things for women in that plan. And it also changes things across the country because plans are using the same basic benefit design now that we have a nationwide standard of what benefits should look like. And so we know that a change in one state can influence changes everywhere else. So what's happening in Delaware could change plans across the country. And we want to make sure that women across the country have this benefit in the way they should. And so persistence really pays off. And so I have a quote here from one woman that we worked with on a claim for her daughter whose Nexplanon implant wasn't being covered without cost sharing. And so she had to go through this process. She had to be persistent. And we know with insurance companies, you all know better than anyone else, that it takes a lot of persistence, that you have to keep calling and asking for the right person and getting through to them and taking the steps that you need to take. And so we have a quote here where she finally got back to us and said, I wanted to let you know that my insurance company finally paid my claim for my daughter's Nexplanon implant yesterday. Hooray! I made some follow-up phone calls last week regarding my request for a second-level review with their appeals committee. They hadn't responded to my written request that I'd submitted over a month earlier. They called me the next day and told me they were going to cover the claim under my preventive services benefit and I wouldn't be charged any out-of-pocket costs. So that's what we want to hear. That's what we want to hear for women who are having trouble. That's what we want to know is happening across the board, that this policy is being changed for her and then it's being changed for everyone else too. So that's the benefit in a nutshell and the common problems we hear. And I just want to take a moment in wrapping up to really just say what a game changer the Affordable Care Act birth control benefit has been for women. So we now know that over 55 million women are now eligible for this important benefit. We know that women are saving money because they don't have costs. I'm going to tell you some data on that in a minute. But we also know that this really means that cost is no longer an obstacle, right? So women are making different choices when it comes to birth control. They're choosing the more effective, longer-acting methods that have had the high out-of-pocket costs that kept women from choosing them before. They're now able to get those methods. It also means that women are able to use birth control for the first time. They're getting methods that are appropriate, so they're using it more consistently and more correctly. And so what we expect to see as the data still comes in and we're able to analyze it is a reduction in unintended pregnancy across the country. And of course that's going to have positive health outcomes for the woman and any children that she has. It's going to mean that it's a positive effect for women long-term and their long-term goals, finishing education or advancing in her career, all of those things. So it's a really, really important benefit that has done so much for women in this country. And I have here a slide from our friends at the Guttmacher Institute that is just showing you here in graph form the great difference that we've seen. So the blue graph is the fall 2012, just before the Affordable Care Act took effect, and then the orange is spring 2014. And you can see how many more women are now paying nothing for the methods of birth control. And what we're hopeful is that we're going to get to the point where it's 100% in the orange and 0% in the blue, and we're working toward that. But this is really making a difference for women across the country. And in terms of some more data, just to share with you on how women are saving money and how they're using it. So we know in 1 year, in 2013, women saved $1.4 billion just on the birth control pill. So you can imagine what that means for a woman's bottom line and her ability to be economically secure and to be able to afford the other things that she and her family needs. It's making a real difference. We also know that more people are filling their prescriptions for birth control pills. So there was nearly a 5% uptick in filled prescriptions in 2013. And we know from Express Scripts, the pharmacy benefit, that the use of insurance coverage for birth control is increasing. It increased 17.2% in a year. And so more people are using their insurance coverage to get the birth control they need. So all of this stuff is good news for women, good news for families, good news for our country. We love this benefit, and I just want to leave you with a couple of resources. Again, our hotline, I'm just going to bang this into your head as much as I can, coverher.org. Visit our hotline, send your patients to our hotline. We're here to help you. And then I also included a link to an IUD and implant guide to reimbursement that we put together with some of our friends that really digs into the billing and coding, and a lot of questions that folks might have on that can be answered with this guide. It's a helpful resource for you. So I will leave it there, and happy to take any questions or